being a healthy person involves multiple different factors. So not just about medicine or going to the doctors, it's about how do you live your life. And so when I focus on trying to change a patient's or a person's behavior, it's about making lifestyle changes that they can implement on a day-to-day basis to improve their overall quality of life. So I wrote a book called Nutrition 2.0. When you're doing treatments that involve regenerative medicine and you're utilizing your own body's healing mechanisms, the healthier you are, the better you heal up. And so that involves diet, that involves physical activity, exercise, posture, alignment, doing activities in a safe way. As a physician, I feel it's my responsibility to set an example for that. How can I tell a patient to eat healthy if I don't eat healthy myself? How can I tell a patient you need to exercise and be fit if I'm not fit myself? So I think it's very important as physicians, we need to be a role model and set the example for patients. If you're 300-400 pounds, out of shape, overweight, and you're telling this patient they need to exercise and do this and that, how are they going to believe that you believe in that type of treatment since you don't practice it? On a day-to-day basis, I like going to the gym, I like working out, lifting weights. I do CrossFit on occasion, I do yoga, I play tennis, I play basketball, I play softball. So I like to incorporate lots of different activities depending on the season, depending on my mood, just to stay active and switch up the routine so I don't get stuck in just one single rut of doing the same exercises over and over. I want to diversify the workouts I do to improve my overall posture and alignment and so I don't develop overuse injuries. My wife, I'm lucky that we're similar in that aspect. We love to travel, we love to do active things, we love to go hiking, we've climbed up Kilimanjaro, we do scuba diving, we run together. And when we came out to Colorado, we began snowboarding, which is a very steep learning curve at first, but once you get it, it's very fun. So I grew up on the south side of Chicago. I was raised by a single mother, and my mom contracted polio when she was 5, so she lost the use of her legs at that time. What that taught me growing up was that I had to be a little bit more independent, had to take more responsibility. At the age of 8, I started off washing laundry by myself. So I would drag the laundry loads downstairs and do all the washing myself. I think that served me well in life. We didn't grow up with a lot of money. Our neighborhood wasn't the worst neighborhood in Chicago, but also wasn't the best. A lot of issues with gang violence. I got together with a group of friends that were all positive and were trying to stay out of trouble. And from a very young age, my mother stressed the importance of education and was always very positive and said, you can be anything you want to be. So I took those qualities and I think that helped me succeed along with lots of luck and mentors and hard work. Our focus is on preventing injuries and treating injuries using your own body's innate healing mechanisms. Most physicians see your problem as a symptom and they just treat the symptoms. Steroid injections help the symptoms of pain, but they don't address the underlying cause of that pain or dysfunction. So we take a very holistic approach to how we treat patients. So if someone comes in with knee arthritis, well, why does that knee hurt and not the other knee? What's going on biomechanically? What's going on with the lumbar spine that we need to address to fix those issues? And then to try to fix those issues, we want to use therapy that the patients can use and empower themselves to get better, as well as regenerative medicine techniques which utilizes the body's own healing mechanisms to repair tissue and to improve function. The funnest stories are when patients come into your office, they can barely walk, can barely do much activity, and they come back after you've treated them and they're complaining that they're getting a little bit of pain when they're doing their triathlon.